Labetalol is a non-selective beta blocker and alpha-1 blocker used primarily to manage hypertension and hypertensive emergencies. As a pharmacologist, it's important to be aware of its pharmacodynamics and potential side effects. Here's an overview. Common side effects. 1. Hypotension. Due to its alpha-1 blockade, labetalol can cause a decrease in blood pressure, potentially leading to dizziness or fainting, especially when standing up quickly. 2. Bradycardia. As a beta blocker, labetalol can reduce heart rate, which might cause symptoms like fatigue, dizziness, or lightheadedness. 3. Fatigue and weakness. This is a common side effect due to its effects on the cardiovascular system and nervous system. 4. Nausea and vomiting. Some patients may experience gastrointestinal disturbances. 5. Dizziness or lightheadedness. Common when standing up too quickly, orthostatic hypotension. Less common, but serious side effects. 1. Bronchospasm. While labetalol is less likely than selective beta blockers to induce bronchospasm, it still can cause it, especially in patients with a history of asthma or chronic obstructive pulmonary disease, COPD. 2. Heart block. This can occur particularly in patients with pre-existing conduction system abnormalities or when combined with other drugs that depress AV conduction. 3. Hepatotoxicity. Though rare, there have been reports of liver injury, ranging from mild elevations in liver enzymes to more severe conditions like hepatitis and jaundice. 4. Peripheral edema. Swelling of the extremities may occur as a result of its vasodilation effects. 5. Depression or mood changes. Some individuals may experience psychological effects, including depression or sleep disturbances. Contraindications and caution. Asthma COPD. Since labetalol blocks both beta-1 and beta-2 receptors, it can lead to bronchoconstriction and exacerbate symptoms in these patients. Severe bradycardia. Caution is required for patients with bradycardia or heart block. Pregnancy. Although not contraindicated, labetalol should be used cautiously during pregnancy, category C, and only if the benefit outweighs the risk. Drug interactions. Calcium channel blockers. Co-administration with non-dihydropyridine calcium channel blockers, verapamil or diltiazem, can enhance negative inotropic effects and lead to severe hypotension or bradycardia. Other antihypertensive drugs. Combining labetalol with other antihypertensive medications such as diuretics or ACE inhibitors may lead to excessive hypotension. Antiarrhythmic medications. Caution is necessary when used with drugs that affect heart rhythm due to increased risk of bradycardia and heart block. Mechanism of action. Labetalol works through both beta-adrenergic blockade, primarily beta-1 and beta-2 receptors, and alpha-1 blockade. The beta blockade reduces heart rate and contractility, leading to a reduction in cardiac output. The alpha-1 blockade causes vasodilation, further helping to lower blood pressure. In conclusion, while labetalol is effective in managing hypertension and certain cardiovascular conditions, its side effects require careful monitoring, particularly in individuals with pre-existing conditions like asthma, heart block, or liver disease. Here's a comparison of hydralazine and labetalol, two medications often used to manage hypertension. They differ in their mechanisms, indications, side effects, and contraindications. Here's a summary in table form. Feature: hydralazine. Mechanism of action. Class: direct vasodilator. Combined alpha and beta adrenergic blocker. Mechanism of action: relaxes vascular smooth muscle, primarily in arteries, reducing afterload. Blocks alpha-1 receptors, vasodilation, and beta receptors, reduces heart rate and contractility. Indications: severe hypertension, hypertensive emergency with caution, heart failure, adjunct. Severe hypertension, hypertensive emergency, chronic hypertension, preeclampsia, eclampsia. Route of administration: oral IV, oral IV. Onset of action: oral 20 to 30 minutes, IV 5 to 20 minutes, oral 1 to 2 hours, 5 to 15 minutes. Duration of action to 6 hours, 6 to 12 hours. Key side effects: reflex tachycardia, headache, lupus-like syndrome with chronic use, flushing, palpitations, bradycardia, fatigue, dizziness, orthostatic hypotension, bronchospasm in asthmatic patients. Contraindications: coronary artery disease, rheumatic heart disease affecting the mitral valve, asthma or bronchospastic conditions, severe bradycardia, heart block, cardiogenic shock. Special populations, safe in pregnancy, used for hypertensive emergencies in pregnancy. Preferred for hypertensive emergencies in pregnancy, e.g. preeclampsia. Monitoring parameters, blood pressure, heart rate, signs of lupus-like syndrome, blood pressure, heart rate, signs of bronchospasm. Advantages, effective for rapid arterial vasodilation. Balanced action on both heart rate and peripheral vasodilation. Disadvantages, can cause reflex tachycardia requiring beta blocker co-administration. May exacerbate bronchospasm and bradycardia in susceptible individuals. Key points. Hydralazine, primarily used when rapid reduction in blood pressure is required or in specific conditions like heart failure or hypertensive emergencies in pregnancy. Reflex tachycardia is a concern. Labetalol offers balanced control over heart rate and blood pressure, making it versatile for various hypertensive emergencies, especially in pregnancy, e.g. preeclampsia. It may cause bradycardia and bronchospasm. Let me know if you need further clarification.